Welcome to Maxim's virtual in-service series. In this video, we're going to discuss heart failure in the setting of our pediatric and adult patients. It's important that nurses be able to identify the signs of heart failure as it can affect any patient of any age at any time and can occur by itself or secondary to another condition. For example, genetic defects, post-operative complications, infection, prematurity, or mechanical ventilation. It can also be the cause of poor feeding, weight loss or gain, and seizures. A couple of fun heart facts to kick us off. Did you know that the human heart can continue beating outside of the body indefinitely as long as it still receives oxygen? Your heart beats 100,000 times a day, pumping 2,000 gallons of blood through 60,000 miles of blood vessels and generating enough energy to drive a truck 20 miles. The atrium of the heart is named for the Latin for entrance hall, while ventricle is from the Latin ventriculus, meaning little belly. In order to understand heart failure, it's essential to understand how blood and electricity flow through the heart. Deoxygenated blood flows from the body into the right atrium via the superior or inferior vena cava. It passes through the tricuspid valve into the right ventricle. Then it is pumped through the pulmonary valve into the pulmonary artery, which carries the blood to the lungs. The pulmonary artery is the only artery in the body that transports deoxygenated blood. Oxygenated blood returns from the lungs via the pulmonary veins and enters the left atrium. From there, it will pass through the mitral valve into the left ventricle, which pumps blood through the aortic valve and into the aorta, where it can then be carried throughout the body. The heart's electrical conduction starts with the sinoatrial node, which communicates with the atria and tells them when it's time to contract. From here, impulses travel through the atrioventricular or AV node, down into the bundle of His, into the left and right bundle branches, then out through the Purkinje fibers. The heart does its best to compensate. However, any errors along this pathway can cause abnormal heart rhythms. Some of these rhythms, such as a one-sided bundle branch block, people can live with for years. Others, such as ventricular fibrillation, are fatal without immediate treatment. What is heart failure? Heart failure is a severe failure of the heart to function properly. There are two types, acute and chronic. Acute heart failure has a rapid onset and is usually caused by infection, an allergic reaction, a pulmonary embolus, medication, or sepsis. With treatment, the heart may recover fully or may go on to become chronic. Chronic heart failure is a progressive deterioration of the heart's ability to function. According to Medicare, this is the #1 reason for hospital admission in the United States. A good example of this would be the patient with congestive heart failure that ate too much salt at Easter dinner, forgot to take their diuretics, and is now in the hospital being treated for fluid overload. With treatment, there's every expectation that they will return to their previous baseline. Risk factors for adults are slightly different than risk factors for children, as heart failure in adults will often develop over time. These factors include a previous heart attack, coronary artery disease, high blood pressure, or faulty valves. Cardiomyopathy, a disease of the heart muscle, may develop due to chronic disease, infection, alcohol, drugs, or medication. Chemotherapy is a well-known cause of heart failure. Myocarditis is an inflammation of the heart muscle, usually caused by infection. Due to advances in medicine, more children than ever born with congenital heart disease grow to be adults. However, they may continue to have symptoms throughout their lifespan. Arrhythmias, chronic pulmonary or renal disease, diabetes, HIV, and hyper or hypothyroidism, hemochromatosis, a hereditary disorder, where iron salts are deposited in the tissue, amyloidosis, in which abnormal protein builds up in the tissue, and age are other key contributors to heart failure in adults. 80% of heart failure patients in the U.S. are over the age of 65. There are two types of heart failure commonly seen in children. The first is overcirculation, which is caused by structural heart defects such as faulty valves and septal defects that allow excess volume into the chamber. Patent foramen ovale and patent ductus arteriosus are common causes of overload in preemies. The second is pump failure, which is caused by damage to the heart muscle so that it no longer contracts. Common risk factors for children include congenital heart disease and infection. Coxsackie myocarditis, caused by enterovirus, contributes up to 50% of cases. Kawasaki disease, rheumatic fever following a strep infection, and staph infections are common culprits. Medications that cause heart failure in children include chemotherapy, immune modulators, oral diabetics, anti-migraine drugs, appetite suppressants, tricyclic antidepressants, and NSAIDs like ibuprofen when used in excess. Heart failure following severe chest trauma is rare, but it happens. Children with muscular dystrophy are at increased risk, believed to be due to underproduction of dystrophin. Dystrophin protects muscles from damage during contraction. Without it, muscle cells are damaged, to be replaced with fat and scar tissue. There are numerous inborn errors of metabolism that can lead to heart failure. Why is this so important? Because 50% of children with dilated cardiomyopathy will need a transplant within 5 years. Due to availability or lack thereof, 1 in 5 children will die waiting for a heart transplant. Of those who receive a heart, only 59% will survive 10 years past donation. 25% will need a second transplant within 5 years. Those who reach the 10-year mark will likely need another transplant in 12 years, and the cycle begins all over again. For this reason, it's essential that children at risk be identified and treated as soon as possible. Heart failure is typically classified as being systolic or diastolic. Systolic or left-sided heart failure occurs when the left side of the heart is unable to function properly. Poor pumping capability leads to a decreased ejection fraction, which is the percentage of blood in the left ventricle pumped into the circulatory system with each beat. 60% is considered normal. It is not unusual to see a heart failure patient with an ejection fraction of 30% or lower. Blood backs up into the left atrium, then into the vasculature of the lungs. Symptoms include pulmonary edema, cardiomegaly, mild to moderately increased jugular venous pressure, shortness of breath, and paroxysmal nocturnal dyspnea. These will be your clients with crackles, wheezes, wet cough, and blood-tinged sputum, and a poor tolerance for activity. Left-sided heart failure can progress to right-sided heart failure. Diastolic or right-sided heart failure is the most readily visible of the two. The right side of the heart is unable to function properly, typically because stiff tissues prevent the heart from fully relaxing to allow for filling between beats. Ejection fraction will be normal. Symptoms include ascites, notable pitting peripheral edema, severely increased jugular venous pressure, hepatomegaly, mild jaundice, decreased appetite, bloating, and constipation. There may be some shortness of breath, but this will be less severe than what is seen in left-sided heart failure. Symptoms of heart failure in children may be less specific or more subtle, and are often representative of the energy required to compensate for their particular heart defect. Symptoms include poor feeding, fatigue, sweating or squatting while feeding, playing or exercising, failure to thrive, cyanosis, exertional dyspnea, heart rate greater than 150 or respiratory rate greater than 50 in a newborn, hepatomegaly, cough, congestion, decreased oxygen saturation, some of these kids live in the 80s, and S3 heart sounds. Edema in the face and limbs is uncommon, but it may occur. Clients will typically undergo multiple tests to diagnose heart failure. While it's unlikely that you as the home health nurse will be actively participating in this process, it's important to be familiar with them. BNP, or brain natriuretic peptide, promotes urine excretion, relaxes blood vessels, and decreases the heart workload. This number will increase as the heart fails. Anything over 400 is associated with a diagnosis of heart failure. Chest X-ray will look for symptoms of heart failure, including congestion of the lungs and readily visible structural defects. Electrocardiogram and electrophysiology testing test the heart electrical pathways. Echocardiograms provide a look at the heart's structure and function using ultrasound. A transesophageal echocardiogram may be done for a better view of the heart's posterior. Stress testing looks for oxygenation during exercise. There are multiple types, and it's possible to use medication to provide the stress if the client is physically unable to exercise themselves. CT scan and MRI provide another look at the heart structures, with an angiogram allows the medical team to look for blockages or abnormalities in the heart's vasculature. Biopsy may be done to look for cancer, infection, or other tissue or cellular anomalies. Treatment of heart failure, whether in adults or children, focuses on identifying the root cause and correcting it if possible. Most will be on at least one medication. If you haven't reviewed your cardiac pharmacology in a while, now's your chance. ACE inhibitors, like lisinopril, are a common first-line drug, but are known for causing a dry cough. These clients may be on ARBs, losartan instead. Beta blockers, like metoprolol, and calcium channel blockers, like amlodipine, are also commonly prescribed. Diuretics, or water pills, such as Lasix or spirolactone, are typically part of a heart failure regimen. Electrolytes should be monitored closely. Vasodilators, such as nitroglycerin or hydralazine, may be prescribed daily or on an as-needed basis. If you have a client on hydralazine for blood pressure, watch prescription labels carefully. Hydroxyzine is a common antihistamine prescribed for anxiety or insomnia, and it's very easy to get the two confused. Ionotropes, such as digoxin, may improve the heart's ability to circulate. Combination medications like Entresto that combine two or more of the groups above are common, and it's very common to see these clients on an anticoagulant such as aspirin or Plavix to prevent clots. If you have a client on any of these medications, be sure to familiarize yourself with common side effects and when you need to contact a physician. Surgical interventions include placement of a pacemaker or AICD to control heart rate and provide defibrillation in the event of an arrhythmia, coronary artery bypass graft or CABG that helps the circulation bypass a blocked artery, and heart valve replacement. Left and right ventricular access devices, which act as artificial pumps, used to only be seen in the hospital and were considered short-term bridge to transplant. Now they can be worn at home and have been used for years. ECMO, or extracorporeal membrane oxygenation, is only performed in the hospital. Outcomes may be poor, but if your client survives and is able to come home, they tend to do well. Children will receive many of the same medication used to treat adults, but in much smaller doses. Always confirm dosing is appropriate for age and weight. These children will also likely be given nutritional supplements to assist with poor growth. The focus with most children is to repair the congenital defects causing the heart failure. They may also undergo pacemaker placement, heart valve replacement, CABG, LVAD and RVAD placement, transplant, or ECMO as well. Children have a much better prognosis when requiring ECMO than adults. This slide demonstrates LVAD device, CABG, and pacemaker. Nursing interventions are essential for improving the quality of life of clients suffering heart failure. Daily weights are essential. The client should weigh themselves first thing every morning after urination, write their weight down, and contact their physician if they have a weight gain of 2 to 3 pounds in a day or greater than 5 pounds in a week, as this is almost always fluid weight. Timely medication administration is vital. They may require feeding assistance or help with positioning. Heart failure patients are rarely comfortable lying flat. Some may have fluid restrictions, and monitoring I&O will be vital. Most will be on a low-sodium diet, may be going through cardiac rehab, and will need nursing to assist with activity restrictions or encouragement as ordered. Thank you for joining us. To obtain your certificate of completion for this module, go to the link below, which is also present in the video description. Once you've passed the post test, a digital copy of your certificate will be issued automatically.